this video, I'm going to be introducing you to our whole school system framework for positive mental health and wellbeing. The reason why we've developed our own framework rather than using some of the other ones that are out there is because we didn't feel that any of the other frameworks really represented the dynamic nature of developing whole school mental health and wellbeing. That's why our model, we've got to admit, looks a bit crazy, but it is swirly on purpose, and that's to represent this iterative cycles of change that you go through when you're developing whole school mental health and wellbeing. So in the centre, we have a leadership and management culture that really champions and believes in positive mental health and wellbeing. Because of that, we have a good policy for staff training and development, and that's training in strategies to support children and young people's mental health, and also training in staff to look after their own wellbeing. And because they've had that training, they then can develop their own wellbeing initiatives that they can figure out what's important to them as a staff team and how that's going to help improve their wellbeing. And if staff wellbeing's better, then it's going to have a positive knock-on effect to children and young people's mental health and wellbeing and that day-to-day experience of wellbeing at school. Then we have the universal taught curriculum, where we're teaching explicit skills and strategies for wellbeing in the curriculum, either in the PSHE curriculum as well as embedding it into the wider curriculum. We have a model for that, which is known as the SEARCH framework, which is a framework to apply and organise your wellbeing strategies which are teachable and learnable. Then we have our targeted interventions for our at-risk young people who may not be able to access CAM support, or maybe don't even need CAM support, but they do need more support around developing wellbeing strategies, and that's where a coaching approach or a wellbeing ambassadors type intervention around early prevention for peer support can really make a big difference. We also have our pathway to specialist provision for young people who are more at risk of developing mental health problems and maybe need to work with an external agency or a program that you're providing in school, but they're much more in need of working with an adult around support for their mental health problems, which may be more challenging. Because you've got all these factors in place, you then get an emergent day-to-day experience of wellbeing where children and young people are having their wellbeing boosted just by going to your school through the positive relationships and interactions that they have with each other and with staff, and they really do feel great and have good wellbeing just by going there, and that is the ultimate aim. All of this is supported by a culture and ethos that facilitates and maintains wellbeing through policy, process and place, and we also have our agencies and stakeholders and parents and carers feeding into that wider ethos. So this is just a brief introduction to our model, and if you want to find out more about this, then please sign up to our free CPD workshops where we talk about different areas of this model in more depth, and you'll be able to find out how to do that in the description box below.